أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Suhaib Awan. I'm a resident physician in Columbus, Ohio. And this video is brought to you by the Sita Jismani Department of Majlis Khudam Al Ahmadiyya, USA. And it is an update to the COVID-19 virus or the novel coronavirus. And as we all know, this virus is spreading rapidly throughout the world. We are seeing many cases being reported daily and many associated severe respiratory illnesses and unfortunately deaths throughout the world. Hazrat Khalifatul Masih al-Khamis Ayyadahullah Ta'ala bin Nasir al-Aziz delivered his Friday sermon on March 20th and highlighted some important healthy practices that we can all inculcate to ensure that our bodies are prepared and are strong to fight off infection if, God forbid, we were to become infected. To understand these healthy practices, it's important that we understand what our immune system is. And our immune system is a collection of organs and some cells, namely white blood cells, that have the capacity and the ability to fight off infection, be it bacterial or fungal or parasitic, or in this case, viral, that they're able to fight them off if we were to become infected. And we've already talked about many different things, such as washing your hands, such as staying socially isolated, and covering your cough and sneeze to prevent becoming infected in the first place and prevent the spread of infection. But then now we can talk about what Hazur has talked about, which is being prepared for if, God forbid, we were to be infected, having our immune system be strong and robust so that it is prepared for that infection. So Hazur talked about certain modifiable risk factors. So in medicine, we have modifiable and non-modifiable risk factors. Non-modifiable risk factors are things like your age, your gender, certain comorbidities that you may already have. For example, if you already have a certain lung disease, these are things that you can't change. But there are several modifiable risk factors, things that we can do to make sure that we are strong enough to fight off infection. So the first modifiable risk factor that Hazur Ayyadullah bin Nasir Aziz spoke about is the importance of sleep hygiene. It's the importance of sleeping on time and then getting a good night's sleep, not undersleeping and not oversleeping. We know that during our sleep time, during the night, there are certain immunologic agents of our body that peak, namely undifferentiated T cells and memory T cells that peak during the night, and those are very important components of our immune system that we need. And if we don't sleep properly, then we don't allow them to rise, the levels to rise in our body. And then we also know that inflammatory cells that we want to keep low become rise if we are sleep deprived. The second modifiable risk factor that Hazur spoke about is the importance of having a healthy diet, and namely keeping away from certain high carb, sugary, oily snacks that can curb our immune system and not allow it to be as robust as we need it to be to fight off infection. And then also, when you're eating those kind of snacks, you're not eating the fresh fruits and vegetables that have the vitamins, the minerals that keep us healthy and keep our immune system strong. The final risk factor, the modifiable risk factor that Hazuri Talib bin Nasir Aziz spoke about, is hydration and the importance of making sure that we're drinking water throughout the day. This is also very important, and we know that dehydrated individuals are more susceptible to infection, to disease, as opposed to hydrated individuals. And if you are suffering from an illness, then sometimes it's recommended to drink some sports drinks that contain electrolytes in them, such as Powerade or Gatorade. That can allow you to become hydrated quickly. And but in the meantime, if you're feeling well, then it's important to just drink water throughout the day to remain hydrated. and that's also very important for our immune systems. Inshallah, we'll put in the description section of this video a link to a blog by a local health organization within Ohio that highlights all three of these, plus a few other modifiable risk factors, including having some moderate activity, etc. To remain healthy and have a robust, strong immune system that our viewers can take a look at and get a little further evidence and reading about these risk factors. Another point that I would like to talk about is the importance of social isolation, especially for young, healthy khuddam like ourselves. The reality is that more than likely young khuddam will probably not become very ill. Of course, there are reports of young healthy people dying from this disease as well, so we have to remain careful. But more than likely the young men will not become severely ill or die from this disease. And it's still, however, important to recognize that we have to remain socially isolated as much as possible, because you can be what's called an asymptomatic carrier. That means that you have the disease, but you don't have any symptoms. You don't have any fever, you don't have any cough, but you are still passing on that disease to the people around you. So if you were to be an asymptomatic carrier and you meet a friend and that friend becomes infected from you, and then that friend goes home and he has elderly parents or elderly grandparents at home, or brothers and sisters with comorbidities, then he passes it on to them. They might not have as strong of an immune system as we do, and they may not be able to handle the disease as well as we may be able to. So it's super important that we remain as socially isolated as we can during this time to prevent the spread of disease, and only go out, only meet with people when it is absolutely necessary. The last and most important point that I would like to highlight that Hazur Yogitala bin Nasr Ali's talked about, the most important modifiable risk factor for Ahmadi Muslims, it is the power of prayer and the importance of prayer. This is something that we can control, how fervently and how often we remember Allah Ta'ala, and how much we are able to reap His mercy, how we can uh, uh, avail the most important weapon that Ahmadi Muslims have, which is prayer. In chapter 26, verse 81 of the Quran, Allah Ta'ala quotes Hazrat Ibrahim alayhi salatu wasalam, who says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينَ, that whenever I become ill, whenever I become sick, it is He alone, it is Allah alone that cures me. So we can take all the precautions, the worldly precautions, and they're important. But at the end of the day, for an Ahmadi Muslim, prayer is above all other things. And we should remember Allah in the middle of the night and beg for His mercy and for His help, that all Ahmadis and mankind in general is freed from this epidemic, this pandemic, and that we all come out of this as safely and with the least amount of casualties and with the least amount of pain and suffering as possible, and that Allah have mercy on on the entire world. Ameen. Assalamu alaikum wa rahmatullahi wa barakatuhu.